Hello everyone, my name is Dr. Austin Blanchon, and in today's video I'm going to be a chiropractor reacting to the Y-strap doc on YouTube, and this video title is Severe Hyperkyphosis, Painful Chiropractic Cracking Adjustment. So I'm going to give you my thoughts on it. We'll get started.
How much from the twist? What do you feel when you do the tightness? Okay. And then if you come up in the chain,
so the chiropractor was observing his range of motion, and based on what I was seeing with that range of motion, obviously this is just an education standpoint. I'm not this person's doctor, nor am I trying to be. That is my health medical disclaimer. This patient didn't have much range of motion at all, could barely really even go down, flex their spine, and they also couldn't really extend their spine as well. So his quality of life does seem to be pretty reduced, as he does have quite a bit of hyperkyphosis, which the hyper is excessive, kyphosis is a normal rounding of our spine, but in his part, it's actually excessive rounding of his spine. Now, I'm sure you're wondering, what are some of the causes of this issue? Potentially some hereditary, lifestyle factors, such as a lot of head trauma, where your head went into this range of motion. So hyperflexion of the head and the neck could aggravate the spine to then get into this state. Some fall onto the tailbone region, where he fell down and went very fast and forcefully into a flexed position, could cause the body to stabilize and form a contracture of ligaments and muscles that held the spine into that position.
Not as much, you know what I mean? It feels good when you kind of do that. But, you know, it's just a lot of tightness when I do it. You shouldn't tighten that.
Gotcha. Yeah, I'll do here.
And the patient was saying that he observes and feels a lot of the tightness into the upper back and to the lower back region. And that's why the chiropractor was wanting to just feel for the tightness and the tone of the muscles in the nearby areas where he was complaining about some of the discomfort.
Yeah, I was on physical therapy, wasn't really doing much. But I was one of massages, they never really did. I spoke to a few specialists in New York City. They don't never sit you with the same doctor all the time. They kept changing doctors all the time. So one would tell me I would need this, get extras for that, get MRIs for this. You one would say I would have nothing, one would say I have.
So this patient is talking about the runaround that he's gotten with other various doctors, which I as a chiropractor have experienced this every single day of my career, that there does seem to be all these different professionals and specialists sometimes saying different things, and they're not in congruence with each other because they are in different facilities or they are different professions altogether, but we are all under the umbrella of healthcare. So I do understand his frustrations and why he feels like he hasn't been able to get super far ahead.
It's affecting me, it's affecting my family, and mainly me and myself. I need to get back to this. I was an athlete, man. I was a mixed martial artist, I've been gymnastics, I've been so athletic, and you know, what I do is, I can't do my bed anymore.
He is saying how all of what's going on in his life is affecting himself. He doesn't feel like he's himself anymore. A very common thing that I've heard from people say. His family is also being affected by this, which is understandable. And interesting, you know, he did say he did some gymnastics and mixed martial arts as well. Now, if he did that, based on my observations of patients that do mixed martial arts and myself, I've done mixed martial arts, he might have had some falls that really stung him too much, where he hit his spine on the mat for mixed martial arts, or had some falls when he was young doing gymnastics that could have cascaded this occurrence of the hyperkyphosis, among other things that he could be experiencing. Because whenever someone has some hyperkyphosis, there could potentially be some nearby organ issues, such as some heart issues, some intestinal issues, just because the spine, it can be super compressed on those nearby organs as well. And sometimes there's actually something known as referral pain that comes from your organs that are so nearby your spinal cord of your spine. When your spine's compressing your organs, it's not going to feel very good. So there's a potential that is happening as well. I'm sure he's probably had some x-rays, some MRIs, and potentially some CT scans to check out to see what the images would show of the internal body parts. That's what I would want as a clinician from this person.
So that right side pulls short compared to the left side.
So now the patient is on the person's stomach on the chiropractic table, and the chiropractor was observing his legs. Now sometimes your legs can be of different lengths. The chiropractor was checking these person's bones to make sure that they're relatively pretty lined up. Sometimes when there's too much tightness on one side, or structurally the body is slightly off, there's going to be very minimal differences, and that minimal difference can cause uneven wear and tear on the body and that can cause issues down the road. And then the chiropractor went over the patient's rounding of the spine just to feel that it does look intense, that the rounding is, because you can see that there's a big dip then where his head goes. I've had a few patients pretty intense hyperkyphosis, so it's not comfortable. They're pretty sometimes hesitant when they are to the chiropractor because they are in so much discomfort, and they just hate being in that way, and they just get so used to where they're being. And it's tough for their body to feel for a change and to stretch it out. It's not typically comfortable for those patients in that intense of a hyperkyphosis.
So you know, but just so everyone at home knows that this can happen. You know, you're not okay. Let me know if there's any pain or something today. Okay. Just okay. Yeah, circle going to the thoracic. Sorry. All this.
Now the chiropractor is doing some orthopedic testing, just general motion palpation of a joint, seeing what joints move and what joints don't. Now how a chiropractor can typically tell is that we were always kind of taught in school and other training that certain parts of the spine are going to move like it's a spring. Certain parts of the spine that don't move very much might feel like a brick of wood or a piece of concrete. Those are the areas that obviously there's something going on. Simple, feeling it can be tough to feel, but I'm sure in this person's case, the areas that feel more tender, or the areas where this person's breath changes as the chiropractor's hands go over certain parts of the spine, those are simple indicators that there might be some issues going on in or around that area. The chiropractor is using one of those vibratory massage guns, which I'm sure a lot of you guys have or have seen them, just to help loosen things up, just move some fluid around. I typically don't use those too much, but I think there's some use for them. Now what the chiropractor was doing was one hand was on his lower portion of his neck, where the other hand was on his head region. The chiropractor was trying to separate those 2 points, trying to cause a stretch in the joint, otherwise known as a high velocity, low amplitude thrust adjustment that chiropractors, osteopathic doctors, and physical therapists can do.
So now that they're here, we're going to be doing a little bit more than the usual, just because I want to do your typical P to A throws, but then I'm going to do P to A with the drop table as well.
Now, what that chiropractor was talking about, the P to A portion, that's just an acronym in chiropractic, just making things more simple than what it needs to be. The P refers to posterior, the A means anterior. The chiropractor was referring to how chiropractor's hands are going from the posterior part of the body, pushing to the anterior part. The whole goal with these adjustments is what I'm assuming is this chiropractor is trying to help this patient be more upright instead of really rounded. So he's pushing backwards, and the table is going to limit some of the motion, so it's trying to help the body go into this range of motion more.
Take a deep breath in and out. Good. One more time, deep breath in and
The
out.
chiropractor is telling the patient to take a breath in, allow the diaphragm to drop down, exhale, diaphragm drops up. That change in the pressure in the air in the lungs can help chiropractor go deeper into the joint, and then apply a thrust, trying to apply a quick stretch to unlock some of the stiff spots into the spine to encourage the movement of the joint. Typically, joints do like to have some movement in their nearby area that typically helps them feel better. I'm sure you're aware of this. I'm sure you've tried to release some of your joints, crack your joints on your own, twist in your chair like that to get a release or feel a pop, and typically you feel better in that area. So there's definitely some efficacy to these high velocity, low amplitude thrusts. Now what you're observing is this chiropractor is using what is called a drop table, where the chiropractor is using the physics of the table. The table mechanism is going to move up a few inches. Then the chiropractor applies the adjustment, and then that table can move down so that you can actually move the joint more. It's just as if, you know, those little balls that you can move the ball and it's hooked up to a string, and then you move that ball and then the rest of the balls move. That is similar nature as to what this chiropractor is most likely trying to do during these adjustments, using that table that makes those loud noises. I do that technique sometimes as well. What if this chiropractor seems to be limited with the equipment that he has? Now, if I was that chiropractor and I've had patients with hyperkyphosis, I typically will use a table that has an automatic distraction piece to it, and that helps to help open up the joints easier.
Okay.
Now, those adjustments are typically trying to help with the rotation or twisting of the mid part of your spine, the thoracic spine, where he has his hyperkyphosis. That adjustment can be difficult when people are that stiff and that rounded. So if I were that chiropractor, that isn't a hard adjustment. I probably would not have done that adjustment. It didn't look like it was very comfortable for the patient as well, which sometimes if you've been to a chiropractor, sometimes it's not the most comfortable experience in certain adjustments. Now what that chiropractor is doing with that patient on their stomach, this chiropractor is adjusting their pelvis, lower back region, or the sacroiliac joint. And he is using the drop table mechanism of the table to encourage movement of these joints. Now what I want you to think about with these joints are the back dimple areas of the lower back. Now imagine when you see someone walking, you see their hips move side to side. My head is called the sacrum bone, my hands are the iliac bones. They move just like this. Whenever you're walking, they should be moving side to side. When someone has a very stiff spine, especially their lower back, typically this adjustment can help restore this motion of their lower back. So when they're walking, you should see their hips and their lower back move from side to side. That's why this chiropractor has his right foot on top of the left foot, trying to encourage movement of the right side of his sacroiliac joint. Sometimes if you've had an x-ray done, you will see the sacroiliac joint come into a triangle where a lot of the compression of the spine comes into the tailbone region. If you've had some pain in your tailbone from sitting for too long, this adjustment can be a benefit to a lot of you if you have that discomfort, for educational purposes and informational purposes only.
I'm going to flip to the other side here.
And now this person is on their side and they are being twisted as this chiropractor is trying to help with their lower back and its ability to rotate and twist. Now, it did look like that chiropractor tried to move that person's spine quite a bit. Some of it did give way, but some of it seems that it did not.
Okay. Someone have you?
Now you can see with that patient, it looks like that adjustment was a little bit uncomfortable. He had to kind of exhale a little bit of his breath because there was so much pressure being built up due to the twisting range of motion. So what I would believe needs to be done is that adjustment needs to be done more gentle and not trying to force so much range of motion. Now I'm sure if you've ever heard, sometimes chiropractors can have the tendency to try to force things to move that don't want to move just yet. And it seems like that adjustment did just that. It was forcing things that did not want to. So as a chiropractor, you need to be more aware and be more gentle.
Okay. Someone have you lay on your back. I got that self-sufficient too.
And you can see how the patient rolls around on the table to see, what areas typically are of concern. He had an interesting time. He had to stand up, then go back on the table, and he couldn't just simply roll on over. A lot of times, if you've experienced severe lower back pain, the twisting range of motion can really irritate the joints because you only have so much twisting in your lower back joints. So whenever you have pain in that area, you really don't want to go into that range of motion very much. So you typically back off, you compensate, and you move around in these various ways trying to avoid pain. Because pain in the body is going to signal all of this adrenaline into the bloodstream and increase your blood sugar. It's going to send you down this cascade of effects that you do not want. Your body is really going to protect your body.
If you're releasing ankle knee, go to the back.
Now what you're experiencing in the chiropractor is pulling on the legs, trying to distract and open up the hip joint and other joints of the knee and ankle, trying to increase the movement of that joint, which this can help sometimes with the proprioception or the awareness of your body.
Arms up. Bring your hands on top of mine. Yep. Okay, so I'm going to lean you back. Squeeze your elbows together. Okay.
Now, this chiropractor is doing a standing adjustment, trying to open up the back because he's too far rounded. So he's going to grab him here, stand him up, and then try to pop one like that to try to open up that spine. And it looks like, based on that patient's reaction, it seemed it didn't go as well because that person is very stiff. I wouldn't expect that adjustment to work on this type of patient. That patient, or that kind of adjustment, you've probably seen people do at parties, party tricks, etc. Seems like it kind of knocked part of the wind out of him because his diaphragm was probably stiffened up during that adjustment.
A good stretch here.
Now, there is a piece of the strap that is going around this person's occiput area, which is the back of the head, then going down to the mandible, which is the jawbone, and it's going to the front of the spine and to the back of the spine. Now, this technique is trying to help open up the space of the neck. In this person's case, you can see how far off the head is from the table. So you can tell there's definitely some structural things going on in this person's spine, because when you're lying on the table, even though part of his lower legs are hanging off, you would imagine that person's head should be closer to the table. There's definitely an excessive amount of rounding in the back. I don't like this Y strap too much. Now, when I do distraction of the spine with my hands or some sort of belt mechanism, I typically just do a stretch and I hold it, and then I slowly let go. And I might do that for a few repetitions. I don't like to just grab it and immediately just pull and yank. I found that to be pretty uncomfortable. And as well, when this person has been stiff for so long, you need a sustained, longer stretch to stretch the ligaments, and you need to do it over a course of a long time and do it very repetitive on a daily, if not weekly basis to actually see long-term changes. Because what we want to see from patients not just are the immediate changes, but actually the long-term changes that happen over a course of months and years. And then he just pulled and immediately just yanked. Now, that's a technique that not all chiropractors do, so this chiropractor is pretty well known for it because he seems that he does it on pretty much everybody. That's my chiropractor reaction video. If you guys like it, there are more reaction videos coming along. Check out the description of this video if you want more chiropractic education videos. And again, this video is just for entertainment and information purposes only. Contact with your own specific doctor if you feel like this is a right technique for you. I appreciate you guys if you guys are still watching. My name is Dr. Austin Blanchon, and I'll see you guys in the next video.